Assalamualaikum and hi, I'm NurAnis Nadzirah will be the first presenter and my partner Nur Syaznie will be the second presenter. We are going to present our final year project. These studies will discuss about the impact of e-learning on mental health among students in UiTM SEREMBAN 3 during COVID-19. Infectious disease known as SARS-CoV-2 coronavirus COVID-19 have been identified in Wuhan, China in 2019 and have reached globally in March 2020. The Malaysian government took the initiative to announce a movement control order MCO to curb the outbreak of COVID-19 infectious disease that has spread worldwide. E-learning has been introduced and coordinated to all students, whether school students or students in higher institutions. Online learning activities have a changing effect on students and lecturers because the use of online platform and students have difficulties accessing the facilities to undertake online learning. The difficulties that students face when learning online affect their emotions, feeling and thought and can invite anxiety in students, which can distract students' focus on their study. Study also found that mental health can affect social interaction, in which the individual may experience fear, anxiety, sadness and depression. Based on the problem that occur in the context of e-learning that affect students' mental health, these studies aim to examine the impact of e-learning on students' mental health in UiTM SEREMBAN 3 during COVID-19. Based on previous study found that students are the group that are often seen to suffer from mental health problems in this COVID-19. In Malaysia, there are few studies on the impact of COVID-19 on mental health and it was largely carried out among students. Numerous cases of mental health issue among students can be seen during this COVID-19 pandemic. Apart from that, during the pandemic, 20.4%, 6.6% and 2.8% of 983 Malaysian students had minimal to moderate marked to severe and most extreme level of anxiety respectively. Hence, students with mental health issues are hesitant to seek help from others and only 7.6% of all students obtain mental health therapy at their university counselling facilities. However, the implementation of movement restriction by the government is also one of the reasons why mental health among students appears to be on the rise because of MCO. The learning methods has been changed to online learning. There are 4 research questions for this study. First is, what is the relationship between a student's social interaction and mental health? Secondly, what is the relationship between a student living environment and mental health? Next, what is the relationship between a student's self-motivation and mental health? Last but not least, what are the significant factors of e-learning on students' mental health? There are 4 research objectives for this study. Firstly is to identify the relationship between a student's social interactions towards mental health. Secondly, to identify the relationship between a student's living environments towards mental health. Next, to identify the relationship between a student's self-motivation towards mental health. Last but not least, to examine the most significant factors of e-learning on students' mental health. Next is conceptual framework of the impact of e-learning on mental health among students in UiTM SEREMBAN 3 during COVID-19. This conceptual framework shows that the independent variable are the social interaction, living environment and self-motivation. Furthermore, the dependent variable is mental health. The hypotheses for this study are: first, the factor of social interactions and students' mental health. HO, there is no relationship between social interactions and students' mental health. HA, there is a relationship between social interactions and students' mental health. Next, the factor of living environments and students' mental health. There is HO, there is no relationship between the living environment and students' mental health. HA, there is a relationship between the living environment and students' mental health. Other than that, the factor of self-motivations and students' mental health. HO, there is no relationship between self-motivations and students' mental health. HA, there is a relationship between students' self-motivations and students' mental health.
So I will continue the presentation. My name is Nur Syaznie binti Abd Hamid and I will present the next chapter, which is chapter 3, methodology. This research is using the quantitative research design and the material used was questionnaire to collect the data. It was conducted by using Google Form and was distributed to the individual who is student and currently staying at UiTM SEREMBAN 3. There are 5,000 of target students in this research and the purposive sampling method was used for sampling size. Therefore, we got a total of 357 students for the expected sample size. The researchers have distributed a survey to 357 respondents, and in return, a total of 306 responses were received from the questionnaire. In this study, the Likert scale was used as the data measurement, and a few statistical analyses were used to analyze the data, such as the descriptive statistic, Pearson correlation, as well as multiple regression, by using the statistical package for the social science, or known as SPSS. Now, moving on to the next chapter, which is the findings of the study. From the demographic profile table, majority of the respondents are female, with 70.9%. The age of 18 to 20 years old has the highest percentage with 49.7%, and for the faculty, FSPPP has the highest percentage at 68.3%. Most of them are from degree with 51%, and students from semester 6 are the most participate in this research with 23.9%. Moving on to the hypothesis summary. From the table, the results for Objective 1 shows that HO1 was rejected and HA1 was accepted. Therefore, there is a relationship between social interaction and students' mental health. This is same goes to Objective number 2, where there is a relationship between living environment and students' mental health. Result for Objective 3 also shows that there is a relationship between self-motivation and students' mental health. So for the last hypothesis, which is to examine the most significant factors of e-learning on students' mental health. The result shows that self-motivation as the main factor because it has the highest beta value with 0.602.
The first summary is to identify the relationship between a student's social interactions towards mental health. Based on the finding, there is a significant factor of social interaction that may affect mental health among students in UiTM SEREMBAN 3 during COVID-19. Second is to identify the relationship between a student's living environment towards mental health. Based on the research, there is a significant relationship between students' living environment towards mental health among students in UiTM SEREMBAN 3 during COVID-19. Next is to identify the relationship between a student's self-motivation towards mental health. These studies prove that there is a relationship between a student's self-motivations towards mental health. Last objective is to examine the most significant factors of e-learning on students' mental health. These studies show that there are significant factors of e-learning on students' mental health. First research recommendation is self-management. The majority of respondents agree that online learning had an impact on their mental health during the COVID-19 outbreak. Poor mental health can cause students depression and anxiety and will harm themselves. Therefore, students can take the initiative to control the problem of their emotional stress by doing activities that students enjoy. Students need to have a balanced self-management. It can help students to control themselves and at the same time help them in reducing the level of stress in studies. Next is seeking support from others. Communication is very important in our daily life because it helps us to not be lonely and unmotivated. Students need to communicate with their family and friends if they feel unmotivated and need someone to talk with. Family moral support can help students be more motivated in their studies and reduce their stress.
Next is the limitation of the research and future recommendations. So the first limitation of this research is that it is a quantitative study where it can be said as time consuming. Therefore, the researchers need to be extra careful in planning in order to obtain perfect randomization and accurate identification of control groups. For future recommendations, qualitative research can be used as it will be less time consuming and the researchers are able to identify opinions of respondents directly. The second limitation of the research is sample size, where the study only involves students in UiTM SEREMBAN. So, with this small sample size, it cannot be generalized to all university students in Malaysia. Therefore, for future studies, the researcher may involve students from other universities to get more accurate and better results. To conclude, researchers found out that the study indicates a positive relationship between the independence variable consists of social interaction, living environment, and self-motivation, and also the dependent variable, which is the mental health of students in UiTM SEREMBAN 3 during COVID-19. Researchers also found out that the most influential factor toward a student's mental health is self-motivation. That's all from us. Thank you.